Hi guys, this is Professor Diaz, and today I will be doing my demonstration on catheter care. So one of the things I want to start before we get started is just kind of understanding what type of devices that can be used for catheterization. So we have three different tools. We have what we call a straight cath, we have a condom catheter, and then we have an indwelling catheter. And these catheters are obviously placed in the urethra, that it's inserted into the bladder so that it can actually empty out the urine. The one I'm going to focus on is this indwelling catheter, which we call Foley catheter. And the reason why they use this is usually either for before or during and after surgery. This may be used, actually it is used. They also use this for if a patient for some odd reason is not able to go to the toilet or can't go to the bedside commode. Either sometimes it could be due to weaknesses or they may be disabled. So this may be an indication of why they may have a catheter. Normally they don't just have it just for incontinence, if they just because this increases the risk of infection. So as a BNA, it's very important, your role is very important in terms of providing good pericare, good hygiene, because one of the biggest things, like I said, is UTIs that can be caused by this. And so I'm going to demonstrate just some important key points that when you're providing catheter care, what you should be doing. Okay, so you're going to always do the beginning steps. Knock on the door when you're upon entering. You want to make sure you introduce yourself and to the patient. You always want to do the dual identifiers. Okay, so you always check their ID band. You also want to make sure that you explain to them what you're going to do. Of course, wash your hands. That's most important. If there's any family members in the room, you want to make sure that you tell them to leave the room, because this is obviously you want to maintain privacy. And so I wash my hands. You want to make sure to put on gloves, okay? Again, I'm not going to show you how to provide pericare, but one of the important things is that when I'm going to put my gloves on real quick. One of the things you just want to make sure that you remember is that if a patient has any fecal matter, you want to make sure that you clean that thoroughly, because one of the things you don't want to ever to go is any of the fecal matter to go inside the vagina, especially when we're talking about females here. So one of the important things that you have to do is that you get a washcloth after you've done pericare, is that you need to actually clean from the meatus at least 4 inches down the catheter. So this again wants to make sure it's cleanliness. You don't want to tug on this in any way and pull it. Okay, so you just want to make sure that you clean this downwards. Okay, so because again, we don't want any of that. This prevents infection. You also want to make sure that they have a tape on. For females, they should have a tape on their thigh. Sometimes they have a stack lock, which is it comes with the kit. And keep in mind that catheters are always done by a nurse or a doctor, so you as a CNA will not be inserting this. But this actually just kind of ensures that it doesn't move around, because you want to make sure that this line is not kinked in any way, it's free flowing, because the urine should be flowing downward. For male patients, they usually will have them taped on their belly, just because though sometimes the penis will go upwards when they urinate, and so it's just kind of maintaining that, I guess, the sense of gravity, not necessarily, but the way they have it set up. So you want to make sure that when you, with your catheter bag, so again, it should be free flowing. You should, when you actually hang this, you want to make sure that it's never on the rail. This is a no-no, okay? Never on the rail. You should always put it on the bed frame. So you would just, and what's nice about these newer beds is that they actually have a location on where to hang your draining system. Okay, so you would just hang it right there. So one of the things that as a CNA, it's very important that when you're communicating with your patient, if they're saying anything, if they're complaining to you about if they're having any pain, any burning, irritation, and that's something when you're doing your pericare, that's one of the things that you want to be observing. If there is any irritation or any secretions or any leakage, because those are things that you're going to have to report to the nurse. You're also going to have to report the color of the urine. It should be a straw color, clear. You should never see any remnants. It shouldn't be cloudy, or you shouldn't see any blood in the urine. If you do, you need to report that to the nurse immediately. And then you're gonna be, usually you'll be emptying these out per shift. Now, if at any point you see this really full of bag, then you definitely need to empty it out sooner. But one of the things that you want to do when you empty these out is making sure that you use a cylinder, so that the cylinder, you would actually put, unclamp it, and then the cylinder, you will actually drain this out, okay? And then you'll measure it, and then you will document accurately. So that's pretty much it for catheter care. So I'll see you next time.